Hi, my name is Waimar. I'm a social behavioral scientist with the Population Council. So my project aims to drive change within my organization to invest more resources to increase our portfolio of work using digital technology in sexual and reproductive health interventions. Population Council has made significant contributions to improving the lives of women and girls in low middle income countries, from research in contraceptive technologies to improving access to family planning services, to initiatives like safe spaces that equip girls with life skills, education, as well as reproductive health knowledge. But even with all this success, we've been slower to embrace the potential of digital technologies in our work. So this raised an important question for me. How can we help our organization build a digital health technology portfolio to better serve women, particularly vulnerable populations, as well as the younger generation who we know are much more engaged with technology. So to kickstart this initiative, a colleague and I drafted a concept note, which we presented to our leadership team. We needed to get their buy-in to enable us to dedicate our time and resources so that we could develop potential digital health ideas for donor engagement and funding. The concept received strong support from the team leads, but progress has stalled for the moment due to changes in leadership at multiple levels within our organization. And so while this initiative hasn't taken off the way I had hoped, we're not giving up. I still believe this is timely and important. So I want to pivot a little here and speak about my leadership journey, as it's given me a chance to dig a little deeper into myself. Going back to slightly over a year ago, when a colleague and WomenLift alum, Sanyuta Mathur, encouraged me to apply for this program, I think I responded something like, no, I'm not in the right place in my career to think about my leadership right now. At the time, I was juggling increased demands at work, raising my children, and caregiving for my mother, who had dementia, and trying to make sense of my role and identity amidst major shifts in the global health field and major institutional reorganization. So Sanyuta reminded me that that's exactly the right time to focus on my leadership journey. And to be honest, I applied because I didn't want to disappoint her. So looking back, I'm so grateful to have been part of the WomenLift cohort this year. This program has really given me great insights into the imposter syndrome and how identity, especially as an Asian woman, shapes my leadership style, and more importantly, the concept of authentic leadership. Through the authentic leadership exercises and reflecting on my core values, I've realized that leadership for me is not about chasing recognition or having more and more peer-reviewed articles or doing the most innovative cutting-edge research. Rather, it's really rooted in building partnerships with communities and to create meaningful change for the communities and within the communities. And as localization and decolonization gains momentum, which are great, I've had to confront an important question. What is the role of a researcher like myself from the global north in this new paradigm? So while research is essential, I've realized that my passion really lies in bridging the gap between evidence and action. So in this next phase of my career, I want to work with local implementers, policymakers, and communities to adapt research findings and the evidence into solutions that are locally driven, contextually appropriate, and sustainable. And for me, authentic leadership is about fostering partnerships and co-creating solutions that center the needs and voices of the communities that we serve. Through this journey, I'm so grateful. I feel I have rediscovered what truly drives me. And I want to thank the WomenLift leadership team, as well as my cohort members who've been with me on this journey. Thank you.